Minnesota has taken a step forward toward allowing safe injection spaces, places where people can use drugs in a controlled environment. Rhode Island is the only other state that allows them, along with a few other cities. But there are still many questions if these could pop up in Minnesota and when. Fox 9's Rose Schmidt looked into this, and Rose, there's still a lot of gray area when it comes to this issue.
There sure is, Kelsey. So lawmakers tell me that $14 million will go toward harm reduction organizations. They help people who have a substance use disorder. That one-time funding will be dispersed until 2029, but what we don't know yet is how exactly that money will be used.
We also hand out these kits, sterile syringes, sterile water.
Southside Harm Reduction Services provides these kits to people who use drugs.
And then we also have fentanyl testing strips so people can test their drugs.
Executive Director Jack Martin is glad to see Minnesota putting money toward harm reduction services and supplies, the same items he provides.
It does signal that Minnesota is willing to make big strides and do what is necessary to address some of these horrible disparities and just unnecessary overdose deaths across all communities that we're facing.
Martin is a big supporter of designated spaces where people can use drugs with trained medical personnel around. But he questions whether this new state law will allow for that. So what does the law say? The Department of Human Services must establish grants to be used for what it calls safe recovery sites, and that those sites could include safe injection spaces.
We don't know if this will open up any safe injection sites or overdose prevention centers in the state of Minnesota, but we do recognize that they are needed and that they would have a real impact.
Adway Pugh approached Minneapolis officials a few years ago about creating safe injection spaces.
I feel like people that are not ready to stop using drugs are going to use drugs anyway. The reason that I know is because I'm a recovered drug user.
Opponents argue that these types of spaces encourage drugs, but we had a public health expert weigh in. Bobby Gass says research shows that's not the case, and these spaces save lives because people can receive proper medical care.
If people have a place to use where other people, especially people trained in harm reduction, in Narcan, around them, they're not going to die.
I asked the state if funding will be used for safe injection sites. DHS officials tell me as they prepare to implement this new law, they'll ask partners and communities how to do so most effectively to help people work toward recovery. Kelsey.
All right. Thank you, Rose. Well,